Welcome back, dear viewers, and you're still watching the Breakfast Show. And in this segment of our program, we will talk about the coronavirus pandemic, the vaccination campaign, which was launched recently by the Ministry of Health. We will also talk about the presidential initiative that aims at treating people at isolation. And we are joined over the phone by Dr. Fady Hennawy, lecturer of internal medicine and hematology, Faculty of Medicine, Ain Shams University. Good morning, Dr. Fady.
Good morning.
So let's start by the initiative which aims at following up the patients who are isolated at home. How successful it is?
Well, we all know that most of the patients nowadays are treated at home because most of the cases are mild or mild to moderate, which means that many of the patients are treated at home and they don't need to be hospitalized or to be admitted at the hospital. And we're so appreciative to the presidential initiative because it gives more credibility to the concern following the patients at home,
yes,
and how to deal with them and how to take the precautions needed when dealing with them. It reaches the people more easily to the public, and especially in the social media and the TV shows. I think it's a great step, and we all needed it.
So also, Doctor, Egypt has received the shipments of 5,000 coronavirus vaccines recently. So can you tell us more about the vaccine and to what extent it will help in curbing the spread of the virus and weakening it?
Well, the vaccines are many types, several types.
Yes.
But in all types, it proved efficacy of at least 60 to 95%
yes,
of preventing the virus spread. And in some studies, it reached 95% of preventing infection. So the vaccine is becoming very important for all the public, but priority would be to certain groups. As President Sisi also mentioned that he's planning to vaccinate from 30 to 35 million in Egypt. That would be a great step and a great achievement to take. The priority would be to the medical healthcare workers and to the elderly people and to the persons with chronic diseases. So that would be the priority. The vaccine would be very useful, and we should, we should trust science because vaccine is science.
So do you expect a decline in the number of cases in the coming period if people abide by the precautionary measures that are listed on the website of the Ministry of Health?
Yes, I think awareness has increased too much the past couple of months in the past period, given the efforts been made by the Ministry of Health on social media and all channels. So I think it's going to be a much less cases reported in the coming period, hopefully. Also, given the cold weather is going to decrease in the coming period, because it's proven that the virus gets more active in the cold weather. So hopefully it's going to be less cases in the coming period.
So, sir, you think that now the government and the Ministry of Health is more aware about the virus and is more capable in dealing with it, unlike before in last March. So how do you see this?
Well, we've known much more about the virus and how it spreads and how to deal with it and how to protect ourselves, especially in the second wave. So I think the experience has increased so much in the second wave, which enabled the country as a whole, as a government, and as the public itself, to deal with the virus and to deal with how how to prevent ourselves from being infected. Like avoiding social gatherings, social distancing, using the masks, using sanitizers, and all of these precautions, we've been more aware than the first wave even.
So, sir, now if we talk about the vaccine and your advice to Egyptian citizens and how dangerous it is, or is it safe?
Yes, so the vaccine has passed through clinical trials.
Yes.
Of course, we have to realize that this vaccine should be different from others in the urgency of public to take the vaccine. But even though the vaccine has passed through many tests and many clinical trials on real patients, human beings, to test its safety and efficacy, and the safety is too high for a vaccine that's been really rapidly developed in such a short time. So yes, generally speaking, it's safe, it's totally safe, and very highly efficient.
So, sir, why do we still see an increase in mortality rate?
Increase in mortality rate. So I think it's not going to increase. It's going to decrease by time.
Yes.
And it's decreasing.
It's decreasing,
actually speaking, if we look at the numbers being pronounced each day. So mortality decreases as, given the gap between developing the disease and monitoring the mortalities. So it's going to decrease like 2 weeks apart from decreasing the cases themselves. So falling the numbers of the newly discovered cases should be followed by decrease in mortalities by about 2 weeks.
Do you think that this increase is related to the fact that many patients go so late to the hospitals? Maybe if they start treatment earlier, this will not be the case.
Definitely, yes, because knowing and being aware of the severe disease, how to know it's severe case or critically ill case. This makes the patient aware of when to go to the hospital and when to seek medical advice, because not all patients are required to seek medical advice. Also, there is a hotline announced by the Ministry of Health. This should help many of the patients to ask about the symptoms, and even the public, not essentially infected patients. The public can ask about what symptoms they should report and what symptoms they should be alarmed of when dealing with the virus.
So, sir, as now we have the vaccine and also many people were infected by the virus and are developing herd immunity. So, do you expect this will lead to the decrease of the infections rates in the coming period, as many people now are developing immunity and others are taking the vaccine? So, this, of course, will lead to the decrease in infections. So, what's your take on this?
Yes, because the vaccine itself is the only way to contain the virus without having so many, high mortalities and morbidities. There are two ways to get rid of the virus. One way is the herd immunity, and the other way is getting the vaccine, or vaccinating the mass public.
Now we have the two. Yes. Now we have the two working together, the vaccine and the herd immunity.
Exactly, but relying more on the vaccine would help us reach better results with less mortality and morbidity.
Yes.
Rather than just letting the people get infected, and many of the public have low immunity.
So finally, I'd like to thank you, Dr. Fady Hennawy, lecturer of internal medicine and hematology faculty of medicine at Ain Shams University. Thank you, sir, for this precious information. And by that, dear viewers, we come to the end of today's edition of The Breakfast Show. I'm Shina Adel, and I was joined today by my colleague Amal Mukhtar. Thank you for watching.